I always encourage my patients, if they're feeling like something's wrong, then get it checked out. When you go to your doctor, probably the first thing they're going to do, in addition to hopefully taking a list of your concerns and doing a thorough thyroid evaluation, sometimes people with thyroid issues have swollen thyroid. So the thyroid can be swollen if it's not working correctly or if it's working too hard. So that's one thing to definitely look at. If you feel something going on right in this general area, that's where your thyroid sits. Definitely get that checked out. If you're feeling off, your doctor may start with some basic thyroid screening tests like a TSH or thyroid stimulating hormone. But really, to fully evaluate the thyroid, we need not just the TSH, because TSH actually comes from your pituitary gland. So your pituitary is this small part of your brain, super, super important. We call it the master gland because it makes a number of releasing hormones. But when it comes to the thyroid, if the brain is sensing not enough thyroid hormone is circulating, it goes up actually to try and stimulate the thyroid to make more thyroid hormone. So that's just a screening test. But we should really check thyroid hormone levels. So the thyroid makes two forms of thyroid hormone, T4 and T3. So T4 and T3 do the work of the thyroid, mainly T3, because T4 is converted to T3. So you at least need those three things to screen for thyroid issues. Now, if we're getting more in depth, we can check for thyroid antibodies that go along with underlying autoimmune thyroid issues. Anything autoimmune is like your immune system working against you. So autoimmune, when it comes to thyroid, is something called Hashimoto thyroiditis, and that's really the most common cause of underactive thyroid. So essentially, the immune system starts misrecognizing the thyroid as its own and starts essentially just infiltrating it with white blood cells. And these white blood cells destroy the architecture of the thyroid so that the thyroid doesn't work as well and we don't have as much thyroid hormone. So in that case, ideally, we should see an elevated TSH because the brain is saying, whoa, what's going on? And lower levels of circulating thyroid hormone. But unfortunately, this can be a really tricky situation. So say you go in and you're not feeling well, like you're concerned about your weight or hair or energy. If you do have an underlying autoimmune thyroid issue, that TSH might miss it. Because if you think about it, the immune system's kind of changing all the time. And there might be enough thyroid hormone circulating at one point, but if the architecture of the thyroid is gradually going down, we miss the diagnosis. Unfortunately, a lot of people, men and women more than men because it does predominate in women, go on with symptoms with underactive thyroid for a long time when it goes on with Hashimoto thyroiditis because we're not catching those screening tests. So that's why it's so important to check not just the TSH, but circulating thyroid levels and thyroid antibodies that can screen for autoimmune thyroid issues.
Are those typical tests, or is that something that you have to proactively ask for?
Now, they may not do all those tests. Usually they'll screen with just a TSH, but I do encourage patients to ask for these other tests too. So the TSH along with free T4, free T3, and thyroid antibodies. So thyroid antibodies they're called anti-TPO. That stands for thyroid peroxidase. So it's anti-TPO or thyroglobulin antibodies, TG antibodies. So that'll screen if you have an underlying autoimmune thyroid issue.